Hello guys, now I will going to discuss about trichuriasis. Trichuriasis is caused by the whipworm, Trichuriasis trichura, a nematode or roundworm that inhabits the cecum and the ascending colon. The principal hosts of Trichuriasis trichura are humans who acquire infection by ingesting embryonated barrel-shaped egg. The larvae escape from the shell in the upper small intestine and penetrate the intestinal villi. The worms slowly move toward the cecum, where the anterior 3/4 whip-like portions remains within the superficial mucosa, and the short posterior end is free in the lumen. In 1 to 3 months, the adult female worms begins producing 5,000 to 20,000 eggs per day. After excretion in the feces, embryonated development occurs in 2 to 4 weeks with optimal temperature and soil conditions. The adult worm lifespan is around 2 years. Regarding epidemiology, trichuriasis occurs throughout the world and is especially common in poor rural communities with inadequate sanitary facilities and the soil contaminated with human or animal feces. Trichuriasis is one of the most prevalent human helminthiasis with an estimated 1 billion infected individuals worldwide. In many parts of the world, where protein-energy malnutrition and anemia are common, the prevalence of Trichuriasis trichiura infection can be as high as 95%. The highest rate of infection occurs among children 5 to 15 years old. Infection develops after ingesting embryonated ova by direct contamination of hands, food such as raw fruits, vegetables fertilized with human feces, or drink. Transmission can also occur indirectly through fleas or other insects. Regarding clinical manifestations, adult trichuriasis ingest approximately 0.05 ml of blood per worm per day. Right lower quadrant or vague periumbilical pain can be a complaint of the patient. Most persons harbor low worm burdens and do not have symptoms. And children who are most likely to be heavily infected frequently suffer from disease and they can have chronic dysentery, rectal prolapse, anemia, poor growth, and developmental or cognitive deficits. When we see diagnosis, treatment, and prevention, because egg output is so high, fecal smears frequently reveal the characteristic barrel-shaped ova of Trichuriasis trichiura. Treatment is by either of the following: albendazole, mebendazole, or ivermectin. Albendazole should be given for 3 days, or mebendazole 100 mg orally twice daily for 3 days. This can be prevented by personal hygiene, improved sanitary conditions, and eliminating the use of human feces as fertilizer. Thank you for your attention. Have a nice time.